Good afternoon, everyone, and thank you for joining us today. Before we start, I would like to begin by acknowledging the traditional custodians of all the lands that we are on today. And while we meet on a virtual platform, I would like to pay my respect to their elders, past, present, and emerging. I also extend that respect to any Aboriginal and Torres Strait Islander people who may be joining us here today. Those who don't know me, my name is Chad Dias and I'm the training coordinator for Jobs Australia. Our facilitator today is Nicole Morrison, Senior Consultant Workers' Compensation from Mercer Marsh Benefits. Nicole, welcome and thank you for this great opportunity. Just a bit of housekeeping. This session will go for 40 minutes and you will get a chance to ask any questions you have at the end of the session. And also there will be a small survey going out after the event as well. So if you could just complete that one, that would be great. Nicole, over to yourself.
Thank you. Good afternoon, everyone. As Chat said, I am the Senior Consultant from Mercer Marsh Benefits here based in Melbourne. So this afternoon, I will be taking you all through a national worker compensation update covering off all states and territories. So we'll begin the session by covering off New South Wales, followed by Victoria, Queensland, South Australia, and then also the risk states. So if everyone's ready, we'll get stuck into New South Wales, and please feel free to ask any questions in the chat box and after this session concludes. So like many other schemes, New South Wales continues to deteriorate. So the New South Wales compensation scheme is currently at a 97% funding ratio as at financial year 2021 results. In its simplest form, a funding ratio is the ratio of available assets to estimated liability. The funding ratio is used to monitor the long-term and financial sustainability of the scheme. The assets are based on market value and the liabilities are estimated by actuarial valuations, which typically happen twice a year for iCare schemes. So essentially, the scheme is running at a loss in New South Wales. For the 22-23 premium year, the premium rates increased by 2.9%, which was massive, from 1.44% to 1.48% of wages. Other changes to note, including 50% of the workplace industry classifications increased. However, 50% also remain the same. Last year, iCare announced that they were going out to tender to bring on board some new insurers back into the scheme. So a lot of you might remember a couple of years ago, there were multiple insurers. I think there was about 4 or 5 in the scheme. And then iCare decided to take it all in-house and use EML as the sole provider. So, and it was announced this year that DXC, formerly known as Exchanging, and Gallagher Bassett were being added back into the scheme as of the 1st of January this year. The contracts will be around for 10 years, so a significant amount of time, with the first agent coming on deck to provide services being Gallagher Bassett, and I believe the date is set for the end of June to allow them to recruit some staff. DXC should follow before the end of the year. iCare were also looking at appointing a psychological provider that would specialise in psychological claims. So there are a number of the insurers that do have dedicated teams for psychological injuries. However, some of them don't have those teams. So for some employers who experience a high volume of psychological injuries and claims, they may opt to go with that particular provider. There was a market freeze that ended at the beginning of this year, but it only ended for employers who had a base tariff premium of over $500,000. iCare are actually looking at the moment and reviewing whether smaller employers would be able to move as well and how that would look like. So it's a watch this space at the moment. New South Wales also continues to address the McDougall and GAC recommendations with a focus on strengthening iCare's culture, governance, accountability, framework and customer outcomes. So the McDougall review took place in 2015, was published, I believe, 2021, and it was a comprehensive review of the whole system. So it did look at how iCare did change to one provider and how it did affect the scheme. The key findings were they were actually running at a loss, which is no surprise here. Return to work rates deteriorated significantly, with EML staff having really high caseloads. The iCare claims management model wasn't very good, and a lot of experience actually left the industry. So a lot of employers did experience when that change came through that they had case managers with zero workers' comp experience, which significantly impacted them. The report also found that iCare, they were quite ambitious with the claims model that they implemented, and they made a decision within a short period of time that it just was not going to work really at the end of the day. We might skip over now to Victoria. So Victoria, like other states, is running at a loss at the moment, a significant loss. So some of you in the work annual report, it did in 2021, it did note a $378 million loss, which was massive. However, the WorkSafe annual report a new report was released in October 2022, stating that they actually made a profit. So the net profit after tax was $43 million, which was the first positive result that the scheme achieved since 2017-2018, which was massive. And it seemed like a massive improvement, but actually it was found that the government had injected somewhat $500,000 into the scheme to get them back into the position that they were in. So currently, according to those figures, the scheme funding ratio was 115%. Most importantly, the claims cost, they were still increasing. However, they were $394 million lower than what they projected in the 6 months prior to June. So that was actually quite a good result. So it was the best result I think they had since 2018. For the 22-23 premium year, WorkSafe announced that it was the claims that were received from the 1st of January 2019 to the 31st of December 2021 would be impacting. However, only the weekly payments made for claims received in the 2021 year would be impacting. So most of you who operate in the VIC scheme would notice that the SCEs that go into these calculations were massive. So a number of claims, the first estimate 3 months into the claim could have been a capped claim or above $500,000, which is massive. And if that were to impact an employer for 3 years running, it would really hurt you. I think WorkSafe announced the weekly payments would only be impacting initially because of the COVID claims that some employers were receiving as a bit of relief. They haven't noted what claims will be impacting for the 23-24 period, which will be finalised in March this year. However, we do believe that they will only use weekly payments again instead of SCE for claims received in 2022 to follow the previous model. In Victoria, there was a WorkSafe agent freeze that has been in place now for a couple of years since CGU exited the scheme and COVID happened. So that was lifted as of the 31st of January. WorkSafe have implemented a formal transition process, and I will go into that a little bit more detail now as well, because I'm sure a number of you may have concerns or have had issues with your current service provider. So at the moment, for employers who have over 10 open active claims on compensation, a transfer to a new agent will take 60 days as a minimum. So if you are interested in moving, all you need to do is chat to the insurer that you'd like to move to. If they've got capacity, they will let you know. From the date you fill out that form and it gets sent to the new provider and WorkSafe approve it, it will be minimum 60 days. There is a massive checklist that the losing agent must complete. all outstanding compensation and actions will need to be completed before you transition. Any employer who has under 10 claims will be able to move almost immediately. So you would need to fill out the form and provide it to the new insurer by the 20th of the month to move on as of the 1st the following month. So it's a much simpler process and a lot easier to do. And again, please reach out if anybody has service concerns with their insurers in either New South Wales or Victoria. Please reach out to myself and I can guide you through the process and we can chat about what that might look like for you. Just going into the WorkSafe annual reporting in a little bit more detail. No surprises, mental health claims continue to impact premiums across all industries. So in the WorkSafe report, figures show that 15% of all new claims were work-related mental health injuries, and this was up from about 13% on previous years. Employers who fail to take reasonable steps to prevent mental injuries can face prosecution under the OH&S Act, including fines up to $332,000 for individuals or $1.6 million for a body corporate. So that's massive. Just a few more call outs from the WorkSafe annual report. The number of claims per million hours actually dropped by 2.9% in 21-22 to 6.36. During that year, they undertook nearly 38,000 workplace inspections and visits and 5,000 virtual inquiries. So that's the WorkSafe return to work inspectors that come out and visit employers. They issued nearly 9,000 improvement notice, which is massive, 137 prosecutions, which is up from 83 in 2021 and 118 in 1920. So prior to COVID, they were issuing quite a lot of them. Again, this is probably also a good way for them to be recovering some money too into the scheme, given that they're running at such a loss at the moment. And the other stuff on that slide we covered off previously too. We'll jump now to WorkCover Queensland. Now, look, WorkCover Queensland, they are running at a loss of $450 million, which is massive. It's important to note, though, that WorkCover Queensland actually has the lowest premium rates in the country at 1.2%. So no surprise that they are running at a loss. The annual report in 2021 noted that there was a trend in increasing claims costs, as well as continued growth in the number of statutory and common law claims. Claims management, common law and the mental health claims have impacted the scheme massively, causing a worsening financial performance. They are reviewing initiatives at the moment to manage mental health claims and exposures better, which is good. Important to note that journey claims and recess claims costs, they're still not premium impacting, but they are looking at these closely. So we suspect that if they see a significant rise in these sorts of claims, that they may change that and they would in fact be premium impacting. Having preferred providers can be useful as well for better outcomes when the providers understand your business and how you work. So that's in regards to rehab providers, also GPs as well. If you have someone local to your business, it's worthwhile setting up an agreement with them to ensure that your workers are looked after. South Australia is probably one of the only states that is running at a surplus now. So the funding ratio is 106%. The Summerfield decision alone increased the scheme liabilities by $584 million, which is massive. Return to Work SA has set the average premium rate for 22-23 at 1.8%. This reflects a rise of 5.9% from 21-22 at the rate of 1.7%. This would have been much larger, over 2%, had the government not committed to the legislative change being the Summerfield decision. So I will cover off more what the Summerfield decision was for those who don't know. So following on from the Summerfield decision late last year, the Impairment Bill 22 was introduced, and it needed to be reviewed by the South Australian Legislative Council. This bill, if it was approved, would reverse the impact of the Summerfield decision. It also introduces a new definition of trauma, which is intended to overcome the Summerfield decision. This will likely result in consequential injuries not being combined for the purpose of assessing a worker's whole person impairment. So the Summerfield decision allowed impairments to be combined. So if a worker suffered 2 or more injuries arising from the same incident, the impairments arising from an injury and a consequential injury allowed the worker to combine it, and then there was a greater chance that the worker actually met the 30% whole person impairment for a serious injury application, which would then lead to common law. So since the release of the proposed bill, the state government actually came to a compromise and said, look, there was a lot of backlash from that decision. Instead, we'll introduce a new legislation as of the 15th of June 2022 after lengthy discussions with worker representatives and businesses. So the new Return to Work Scheme Sustainability Bill 22 would enable workers to be compensated for cumulative injuries while also protecting businesses from significant rises in premiums by increasing the threshold workers to qualify as seriously injured. So prior to this, it was 30%, but the bill will now change the threshold from 30% to 35%. So this will ensure that there was a break-even premium rate of 1.9% versus the potential increase by 2.2%. That was massive. They really did cop a lot of backlash from employers because we had a number of workers who they were hitting that 30% and going down common law, costing businesses a lot of money and the scheme as well. Okay, now over to the west now, WA. So the recommended premium rates were published in 2022 by PwC's actuarial report. That came into effect in June last year. The recommended rate increased by 6.9%. This was driven by 16% increase in incurred costs for the scheme, driven by higher average claim size, higher number of claims offset by wage growth. Now, look, WA is relatively quiet in terms of claims activity when compared to other states, but they have had significant claims that have cost the scheme a lot of money that has driven this. There was a draft bill to modernise the workers' compensation laws, and that was a election promise in 2021 that they've been looking at. So this draft bill to modernise the workers' compensation laws has now been signed by the Minister. If it's approved by Parliament, the changes may be into effect by December this year at the earliest or July next year. The changes outlined in the bill will impact the cost of claims, policy ratings, and the industrial disease policies. So the changes include an increased cap on the medical and health expenses that a worker can access, extending the time in which their income support payments actually step down. So instead of dropping down at 13 weeks, it would now drop down at 26 weeks. And overall, the lifetime care and support arrangements would be extended for catastrophically injured workers too. So it was focused on workers and looking after injured workers. So down in Tassie, the WorkCover Tassie has looked at the accreditation framework for workplace rehab providers, or occupational rehab providers as we know them in some states. The framework is really to set out best practice, the expectations, and also focus on providing the best possible service for injured workers when accessing these services. I guess across all schemes, there is an impression for workers to think that the rehab providers really just work for an employer or the insurer, and they feel that they're being sometimes pushed to do things, but it's really focusing now on workers' treatment and their rehabilitation and sustaining return to work. So in Tassie, there's a lot of job placements and things that workers can do, and it's just ensuring that they're meeting those requirements now. Tassie has also announced return to work inspectors like in Victoria as part of their compliance program. So this will be focusing on the work health and safety compliance, and they will have announced and unannounced visits expected across the 12 months. So the focus is just on employers to demonstrate that they are actively managing claims and have a safe work environment. So I think they're just coming up to speed now with the rest of the states. Important to note as well, the asbestos levy in Tassie has now reduced from 2.5% to 2% for policies that have been placed from the 1st of July onwards. Over to the ACT. So ACT, the premium rate has actually been unchanged as of 22-23 period at 2.22% of wages. It's important to note that their claim frequency is coming down, but the average claim size is increasing. So the severity of the claims and the costs associated are increasing. No surprises, same as the other schemes too. Due to the insurers' portfolios being small, so $200 million in total in the underwritten scheme, insurers' profitability is actually heavily impacted and they're exposed to large losses. So essentially, they've got a number of workers and they don't have many claims to manage, and the scheme's not making money from it. The scheme is also heavily impacted by the common law because there is no threshold on eligibility, and the benefits are actually unlimited in that state. So it's very pro-worker, and the workers are very well looked after. The increasing scheme levies and claims developments in the recent years were greater than the insurer had forecasted, resulting in the insurers correcting pricing strategies and implementing at the start of the financial year 23. At the close of the calendar year, insurers and the ACT have revised pricing strategies and implemented increases already, regardless of performance. So my team has noted that the policies with nil claims incurring will have potentially a 10% increase on the expiring premiums, while those that do have claims might actually see increases greater than 20%, which is massive. Jumping over to Northern Territory now, lastly. So PwC, in the last report that they released, noted the funding ratio was 109% for insurers and self-insurers, which meant that there was sufficient funds within the scheme to meet future costs. So they were performing better than the other states like South Australia. Premium rates charged by insurers actually hit a 10-year low in 17-18, which was largely driven by the IMPEX project. Since the project commenced operations in 2018, the premium rates have increased now, with the average premium rate being 2.1%, which is equivalent to the break-even rate that was assessed by PwC. The scheme continues to have a decrease in claim numbers and frequency, but the average cost of a claim is sitting at about $56,000, which is quite small comparing it to other states. Due to the small size of the scheme, the 22 performance will be significantly impacted by large-scale projects, and it is noted that there was one large project that commenced in 2022 that will now impact the scheme. So we are seeing a steady increase in the premium rates now, and it's expected to slowly increase. And that brings all the states to a close now. So chat, we might open up to see if anybody has any questions that they wanted to cover off, or if there's anything that anyone wanted me to go back over to look at.
Thanks, Nicole. So I opened up the chat room. They can either request to unmute their microphone, or they can just put that into the chat. We will also recorded the session, so we'll send it out after the event. So if the participants wants to get in touch with Nicole, I will include your email address as well.
Yes, perfect.
We'll give them probably 5 minutes if they have any questions.
As chat mentioned, if there's any questions that anyone has, or questions about insurer and what to do, chat will share my details around, and please feel free to reach out at any point. Obviously, with a number of states, renewals might be coming up as well for you, so it's important to know where the scheme is at for those renewals.
Looks like we have no questions, Nicole, so we might just conclude the session. And like you mentioned, if they have any questions, they can always contact us via email. So thank you, Nicole. Thank you, everyone, for joining us today.
Thanks, everyone.